Hello AMP students, my name is Eric Barn, and today I'm going to be taking you guys through an example having to do with the spinal cord model. So to do this, we're going to look at this example here. So one of your patients has come in with damage to one of their spinal nerves. They ask you if this will affect their motor, sensory functions, or both. So to help your patient understand the extent of their injury, you draw a diagram to help them understand exactly what's going to be affected here. So if we look here at this picture, this is going to be a cross-section of your spinal cord, and you're looking from a superior view. So if we're looking from the superior view, the first thing we can do is identify ventral versus dorsal. So ventral is always going to be the side with the bigger horns, or the fatter horns. So these two are going to be your ventral horns, meaning the other two have to be your dorsal. And I will draw a D up here to represent dorsal, and a V down here to represent ventral. And dorsal can also be synonymous with posterior, and ventral can be synonymous with anterior. So the next thing we can do is start to draw these roots. We're going to have dorsal and ventral roots, and I like to think of this kind of like a tree, where you start at the roots. So we can start to draw these roots coming off of the horns, or I'll draw these in orange, so we can be consistent with the colors. And then your ventral roots can come out this way as blue. Okay, so the next thing that we can say is that these dorsal roots are going to be carrying only sensory information. And this is going to be afferent information, and it's going to be coming into the spinal cord. And then these ventral roots are going to be motor, and they're going to be carrying information away, or efferent. So the next thing that we can tell our patient is that these roots are going to converge, but there's also one important structure on the dorsal roots that we need to identify, and I'll give you guys a second to try to guess what that one is. So we can identify the dorsal root ganglion. So I'll draw kind of a bulb here. That's going to represent our dorsal root ganglion right here. And this is just going to relay all those sensory functions back to that spinal cord, and that's what it's going to help with. So now that we've identified that dorsal root ganglion, we can represent all these fibers starting to converge up this way. And this is where they will finally make that spinal nerve. So I'll circle the spinal nerve in black so it's a little bit easier to see. So this right here is going to be your spinal nerve. So if we look at this color coding here, we can see that that is mixed. So this injury in particular to that spinal nerve, if we say it got cut right here, then both sensory and motor functions are going to be impaired to an extent. And then there are a couple more things that we can also draw coming off of this that may clarify to the patient a couple things. So we can also draw the rami after the spinal nerve. So if we continue to the rami, we're going to have sensory function and motor function at both of these rami. So we can draw blue and orange together in both of the rami. So if we continue these sensory rami or dorsal rami, and then these motor or ventral, we can see that both of these rami are going to be mixed. So if there is an injury to these rami, both motor and sensory would also be impaired. And then just something to add here, if there was an injury at the level right here, if that was cut, what do you guys think would happen? Or what kind of function would be impaired? So sensory function would be impaired. And why? Because as you can see from these roots to the dorsal root ganglion, it's only sensory function that's going to be cut off here. All this motor function can still go and fire properly. And then just the opposite of that is if we cut right here, then all of your motor function would be impaired and your sensory information would be okay. So it all depends where exactly the injury happens. So depending upon where it happens, you can have a loss of motor function, you could have a loss of sensory function, or you could have a loss of both. So thank you guys for listening, and have a great rest of your week.